There were 8 new coronavirus deaths reported in Washington yesterday. While most of the state is seeing a decline in cases and deaths, the opposite is happening in Yakima County. Vanessa Mashanya takes a look at what's happening there.
Yakima County has the second highest number of coronavirus cases in the state. Last count at 2,958.
But it's certainly one of the highest in Washington and certainly on the West Coast.
It's gotten so bad that on May 11th, a strike team of Department of Health and CDC infection specialists went there for 2 weeks, initially to help out with outbreaks at long-term care facilities. But they found out there's a bigger concern.
While we were there, we assisted them with other outbreaks, including the Sunnyside Jail. There was a food processing plant. There was really a big need in a lot of farm and agricultural facilities.
Why Yakima? Lindquist says it is the amount of critical food infrastructure there. Farms, factories, processing plants. They require a lot of people working closely to get the job done.
A large percentage of their population is critical infrastructure. So that means they're associated with the food or processing industries, and that puts their workers at greater risk.
Yakima County is also getting a lot of attention because of this, demonstrations. Workers going on strike saying they don't feel like enough is being done to protect them.
What I hear from the workers is a lot of fear, a lot of concern.
Rosalinda Guyen is the executive director of Community to Community Development and has been advocating for striking workers. She says in other essential industries, safety is being put in front of profits. Theirs shouldn't be different.
This is not and should not be about business as usual. It should not be about maximizing the agricultural economy for the state of Washington to keep us afloat. It should be about what it is with every other industry, keeping the number of cases down, keeping people safe.
Tomorrow, the DOH will be taking lessons learned from 2 weeks in Yakima and then turning them into guidelines for ag businesses across the state. For those on the picket line, they hope their concerns will be applied in the same way. For King 5, I'm Vanessa Mashanya.
June 1st is a date that many people have been eyeing. That's when the governor suggested most of the state could move to phase 2 of reopening. But as we get closer to that date, it looks like some counties will not hit that milestone. Here's a look at the counties already in phase 2. 21 have been allowed to reopen more businesses, but the biggest counties in our state are not on that list. In Snohomish County, they're still trying to find a balance between reopening and keeping people safe. King 5's Eric Wilkinson found some people who are tired of the slow process.
Snohomish County health officials say we will not be reopening for phase 2 next week as hoped, but you can see that some businesses are reopening on their own by reinterpreting what it means to be an essential business. Anna's Home Furniture opened for its annual Memorial Day sale this weekend after losing 90% of its business since the statewide lockdown took hold. The frustrations rising as the profits keep falling.
Goalposts keep getting moved further and further back, and you know, people are tired of it, and as a business owner, our employees are struggling as well, and so you know, we need to get back to work.
Snohomish County now has the highest unemployment rate in the state at just over 20%. Fong Nguyen brought his workers back by declaring himself an essential business. If sleep is essential, then beds and couches must be too. He believes the governor's reopening requirements are too strict.
We want to keep everybody safe, but we can do this slowly and gradually if he just lets us do it.
But county officials say we're just not there yet for a June 1st shift to phase 2 of the reopening process. While hospital capacity and the amount of personal protective equipment are both in good shape, Snohomish County Health Officer Chris Spitter says we are still only doing about half the number of coronavirus tests that are needed. The biggest problem, though, is the number of positive cases. Right now, the county is seeing about 300 every 2 weeks. That number needs to be no higher than 80. But Dr. Spitters wonders if there might be a way around that.
That's the goal. If we have trouble achieving it, we're gonna, talk to the state about whether the strength of our overall response capacity will still permit us to move ahead.
So when will Snohomish County be able to reopen for phase 2? Well, it's not what a lot of people want to hear, but right now county officials say they simply don't know. In Linwood, Eric Wilkinson, King 5 News.
Kitsap County applied to move on to phase 2 of the governor's Safe Start plan. The Kitsap Public Health Board is holding a special online meeting today at 1 p.m. to vote on the request. This is the first step in the process. Once approved, the application will be forwarded to the Board of County Commissioners for consideration.
We're keeping an eye on all kinds of numbers when it comes to COVID-19 in Washington state. One number in particular appears to be especially encouraging news right now. That number is the percent of positive COVID-19 tests. Since the Department of Health started posting records on coronavirus on February 27th, 6.1% of all tests have come back positive. But that's a rolling average of all tests since the start. Early on, testing was slow, and they were happening mostly in nursing homes, where the infection rates were higher. So in some respects, early, slow testing skewed the average. So we broke down the last full week of Department of Health data considered complete. Between May 11th and May 17th, only 4% of tests came back positive. As testing goes up, the number of confirmed positive cases on average only decreases even faster. And that's the same trend nationally, according to national health officials. And here in Washington state, of all the confirmed cases, 5.3% have resulted in death. I spoke with a professor at the University of Washington School of Health about these numbers. Dr. Anirban Basu makes the point that the positivity rate, it's not a direct measure of the spread of the infection in the community. It all depends on how much testing we have right now, which he says is still not enough.